Global Package as defined by CPT. The Global Surgical Package bundles pre-op, intra-op, and post-op services into one payment. This applies to procedures done in hospitals, outpatient centers, or even offices. The global period can be 0, 10, or 90 days depending on the procedure. CMS uses standard global package definitions, but some commercial payers may have their versions. Always check individual payer rules when coding surgeries. Section 3, Medical Necessity. Medical necessity means a service is appropriate and effective for the patient's diagnosis. For Medicare, services must be reasonable and necessary under Title 13 of the Social Security Act. Medicare defines what's covered through National Coverage Determinations, NCDs. Local Coverage Determinations, LCDs, set by Medicare Administrative Contractors, MAC. LCDs may also include related billing and coding articles which list diagnosis codes that support payment. The claim may be denied if the diagnosis doesn't meet those requirements.